Hi, my name's Michaela,
And I'm Kira.
and welcome to Let's Ace It podcast.
Today we will be spilling the tea on our first clinical rotation.
Our first clinical rotation. Welcome back. Thank you so much for listening last week. If you did chime in, and if you didn't, go listen to it because nothing's going to make sense if you don't go and listen to our first and second podcast.
Yes, the second one was a prep for today's episode.
Exactly. Yeah. You have to know what to bring to your clinical rotations to be able to know how to act. I get it.
Yeah, all right, let's get into
So,
our first clinical rotation.
so what type of clinical rotation, like, where did you start? Like, kind of describe it, go over it a little bit, tell me about it.
Okay, let me set the setting for you all. I am currently at a small hospital. It's a critical care hospital. Critical care meaning that we only have one floor, and our hospital only carries about 18 med surge beds, 8
Wow.
ICU beds, and only 20 emergency department beds. So if a patient comes in and they're severely sick and the providers think that their length of stay is going to be greater than 3 to 5 days, they have to get transferred out. So that's just to set how small this hospital is.
So
And
when they get transferred out, do they go to like another close town or is it far
mhm,
away?
they go to our next hospital that's about 30 to 40 minutes away. Yeah.
Okay.
So a lot of patients get life flighted out.
Oh, wow. Okay.
Mm-hmm. And then it's a community hospital, so we also have infusion center, a birth center, wound care, imaging, MRI. We do all of those. Oh, and physical therapy. We do all of those there at the hospital as well.
Do you have like a lot of experience like working with those clinics? Like, have you been to the infusion center? Are you doing anything with those types of clinics, or are you mainly just staying in the hospital?
Mainly just in the hospital. I mean, in the pharmacy.
Interesting. Well, that's cool.
Mm-hmm.
I guess go over a little bit about kind of setting the stage of my first rotation. My first rotation, it was at a specialty pharmacy. The specialty pharmacy is nowhere near the hospital. It's in its own secluded little building. And the specialty pharmacy within it had about, I think, 3 clinics. So it had a
Mm-hmm.
rheumatology clinic, it had our specialty pharmacy, and it had our oncology clinic as well. So all of the medications that kind of come from those areas are all grouped in to like a specialty type of medication. Our specialty pharmacies operations, so the way that they worked, I mean, just like any other pharmacy, the doctor's office would send over a prescription and it'd go to the specialty pharmacy. The pharmacy technicians would type up the prescription just like normal, and then they have these medication advocates. So after it
Mm-hmm.
goes to the pharmacy technician, it'll go to the medication advocate. And the medication advocate's main role is to process insurance, prior authorizations, and really to get that medication covered for the patient. So
Mm-hmm.
that is kind of the first roadblock, not necessarily roadblock, but something that's a lot different than regular pharmacies, because regular pharmacies, the pharmacy technicians are doing the prior authorizations, doing the insurance, and working on getting copay cards for patients, but they have a specific role for that.
Mm-hmm.
I guess that's kind of a brief overview. I mean, after the it goes to the insurance, we fill the prescription just like normal. But I mean, there's a set of different standards and rules for a lot of these medications just because they're more expensive. So maybe if they're a lot of these medications are hazardous medications, so we have to take precautions, whether it's wearing gloves or goggles. You put a label on it just like you put a label on a bottle, but they just take a lot more care with the prescriptions due to the high cost surrounding that.
So, do the patients come into the pharmacy to receive the dose, or is it mailed out or shipped to their facility by a courier?
Yeah, that's That's a good point. Our specialty pharmacy was closed door, so we actually didn't see any patients. When I went to the clinics, like the rheumatology clinic or the oncology clinic, they're actually seeing patients there. So for rheumatology, they're dealing with rheumatoid arthritis, lots of like psoriasis, different
Mm-hmm.
things like that. And so there's actually doctors in the clinic, and the pharmacist can actually go into the rooms with the patients and show them how to administer it. So that's a different aspect being in the clinics, but
Yeah.
the specialty pharmacy, yeah, it's closed door.
Which did you prefer, interacting with the patients or just dealing with the insurance side of everything?
So I think there was pros and cons to both. A little bit that I didn't say about in when I was in the specialty pharmacy is yes, we're closed door, but we also do a lot of like counseling to the patients as well.
Mm-hmm.
So like medications that don't fit into rheumatology and oncology but are still considered specialty medications, that the specialty pharmacy is counseling these patients, and we're constantly on the phone with them. So I
Yeah.
think I liked that part the most because it was pretty remote, and you also got to interact with a broad patient population as well.
Yeah.
But yeah, that was my experience in specialty pharmacy. So when you started your hospital rotation, tell me about like how you like contacted your preceptor and then like your arrival on the first day.
Mm-hmm. So I contacted my preceptor with an initial email, kind of just introducing myself and kind of saying why I'm excited to do this rotation. And then I just had a list of questions for starting the rotation, such as like, what is my schedule going to be like? Where can I park? What's the dress code? And then how should I prepare for this rotation. And then for our school, it was required to send this lengthy email regarding our goals. So I like had told them like I will be sending that later. So it was kind of like a initial interaction and then a more formal email.
So when they emailed you back about the times about when you had to show up, what was like your daily?
Yeah, it was just gonna be Monday through Friday, 8 to 4:30, which was really nice because I got to get off of rotations early.
Yeah, I kind of like wondered about that a little bit. Is your hospital, since it's such a small hospital, critical care, is the pharmacy open overnight or?
Yeah, it's not open overnight actually. So what happens is first pharmacist opens at 7:30. I believe. And then we have the infusion pharmacists come in at 8, and then we have a second clinical pharmacist come in at 11:30. So that second clinical pharmacist ends at, I want to say, 8 p.m., and once 8 p.m. hits, the neighboring hospital that's still in our health system will take over all of our patients.
Interesting.
Yeah.
Yeah, I think that when I did my IPI rotations with this health system, the hospital that I was at, it was open overnight. And I think I remember them talking about like transferring the phones, changing all the work queues. Because
Mm-hmm.
there's also a coastal hospital
Correct.
in the same health system that also is not open overnight. So they send like all of their work queues and stuff to
Yeah.
different
So I
hospitals.
think about two of the hospitals are still open overnight. Like two of the bigger ones, and they take over the ones that are closed. I think that's how it works. I'm not sure.
Yeah, so when I first emailed my preceptor for my specialty pharmacy rotation, I asked essentially all of the same questions because we have a template that we send out to our preceptors to get all these questions answered. And they sent back a entire like email about all the different clinics, all the different hours that the clinics are open. You get to choose which clinics you want to go to. And then they gave a dress code as well. No scrubs for my
Mm.
specialty pharmacy. It was just business casual. And then they told me brief instructions on what to do on my day and like how to get there. So
Mm-hmm.
it wasn't anything too abstract or wild.
Yeah, I got a syllabus for their site, and which was really nice because it kind of broke down what was expected of me each week and what I would be kind of doing on a daily basis. So at my site, I did a total of 12 weeks. So each week I had a new project to do. And then each day I have my daily tasks like medication monitoring, setting up anti-coag clinics, and doing discharges. So those are kind of like my three main things that I do on a day-to-day basis.
So, what are some of the products that you've been doing on a weekly basis?
Yeah, so my projects are a care plan. So that means looking up a patient and seeing what disease we're treating for and trying to make sure that there's no drug interactions, no inappropriate treatments. And then the second project was a DI article or article review paper. And for those ones, I kind of did. I don't think I did any DI papers. I think I just did article reviews. And then I did two case presentations. And then every Tuesdays and Thursdays I go to an antimicrobial stewardship. So that's where I meet with all of the health system pharmacists and then an ID physician, and we go over any antibiotics that we have questions on.
It's interesting.
Mm-hmm.
Yeah, the case presentations, were those just patients that you kind of had been working up from your patient panels that you have?
Mm-hmm. Yeah, or I had the option, like if I found someone interesting, I would do it. My first one was about hepatic encephalopathy. And then my second one is on diabetic foot infections, going over the IDSA guideline updates. Yeah, it's really
Yeah,
fun.
I had a couple of projects that I worked on too during my first rotation. I did a journal club and a case presentation, and
Nice.
then I had daily tasks like discharges as well. And then I did med reviews for patients. Like if a patient was getting like a new medication, I'd go through all of their medications, run it through interaction checkers, and make sure if there were any interactions, like what did we need to adjust their dose if we needed
Mm-hmm.
to. So those were like kind of daily tasks that I was doing. But my journal club, I'm trying to remember it. My journal club was on a medication, a biologic injectable for ulcerative colitis, I believe.
Mm-hmm.
And it's pretty interesting. You kind of have to, when you're doing journal clubs, you have to like look at the medication that they're talking about in the article, and then also kind of identify medications that are being used for that disease state, and kind of talk about the pros and cons, why one's better, why this is a good medication to be added for the treatment regimen of that disease.
Journal clubs are
And
difficult.
yeah, that it's definitely, I'm very glad that I experienced a journal club before going into some upcoming rotations.
Yeah. What were your expectations of this rotation before going in?
My personal expectations. I thought
Yeah.
like you're talking about the expectations of me. I was like, I don't know. My expectations. So my whole thing is that my end goal is to work with underserved communities, so low income
Mm-hmm.
populations, minorities, things like that. And I thought going into a specialty pharmacy, I was like, the patient populations that I want to target, like we're not going to be helping them in this field. Like these medications are way too expensive. Nobody can
Yeah.
afford this. And then I went into this rotation and realized that they have like a whole like group and like medication advocates, and everybody, all the pharmacists, pharmacy technicians, they're there to get this medication covered for you and to
Mm-hmm.
reduce the cost for you as much as possible. And so I thought that it wasn't going to apply to anything that I wanted to do, but it actually ended up being very applicable to the field that I want to go into.
Yeah, when I worked at a specialty pharmacy, a lot of our patients' meds were covered because they were part of the clinical trial.
Wow.
Yeah.
Yeah, we had a pharmacist come in and talk about her journey with cancer treatment. And she was on in the clinical trial for the medications that she was on. And
Was it a
like
good
she's,
outcome for her?
yeah, she's like, she talked about it and it's crazy.
That's crazy. Like how she's a number in that study. And when you're
Yeah,
doing a journal club, you're just like 0.85%. And she's point like she's part of
I
that
know.
study. That's crazy.
What were your expectations going into the hospital? Did you like have
Oh,
any
I was
anxiety?
scared. I was nervous. I feel like my IPI hospital rotation did not prepare me enough because it was so surface level. But in the hospital, I thought it was going to be a lot more chaotic, a lot more math, but it's actually not that bad. But I think it's just the site that I'm at because it's so small that we have time to look at patients like thoroughly, and there's not really a rush. And there's only a few hospitalists or physicians that work there, so you tend to kind of form good relationships with them, and it's really nice because they kind of bounce ideas off of you, and they really appreciate your knowledge on medication. And it's not as scary as I thought. And all the math and numbers that I was terrified about, the pharmacists use calculators. Like they use like MD Calc or ClinCalc to do their vancomycin dosing, and they use Lexicomp to double check their knowledge on like if a antibiotic needs to be renally adjusted. So I mean, I actually love hospital pharmacy now that I'm done with this rotation.
That's what I was gonna ask you. I was Now that you finished this rotation, like have your goals changed? Like what you want to do after pharmacy
Oh,
school?
100%. Like it just feels so much more rewarding being able to work up a patient from admit to discharge and kind of see all of the working and moving parts of pharmacy. And yeah, it's no longer like when you're at retail, you only see the medication they're getting and you kind of have to make an educated guess on why they're taking the medication. Whereas in the hospital, you kind of have like more say and more input on their care that they're getting in the hospital. So I love it.
So you've kind of talked about like what's super rewarding about working
Hmm.
in the hospital. What do you think was like your hardest moment throughout your
Ugh,
rotation?
the hardest moment. Let me think. So right now it's just understanding like all of the things that the techs do in the hospital. I think it's just all I don't know all of the different formulations. So like if a patient comes in and they can't take anything like anything by mouth, I don't know like the different formulations for the medication. So I kind of struggle on that part on making recommendations for that.
Is there an IV room?
There is.
Do you go in the IV room?
No.
Okay.
I went in there once to learn, like just to observe.
Uh-huh.
And then, like, even today, I just practiced making IV bags, but it was all with expired medications. I
Mhm.
am truly afraid to be alone in a hospital where I have to go into the IV room because I have no knowledge. Clue.
Mhm. I think that during my specialty pharmacy rotation, my most rewarding and memorable moment was when I was doing this counsel for a patient that had just transferred to us.
Mm-hmm.
And I was talking to them, and they were just telling me everything about their life. Like, I think, got diagnosed like 4 months ago. Like,
Oh.
it was really early. They were telling me everything, their entire life story, and it was really rewarding that they felt comfortable sharing that with me initially,
Mm-hmm.
and it just further my wants and goals to work with that type of community, like
Mm-hmm.
underserved patients, or patients that are minority, or
Mm-hmm.
HIV populations. I just really love working with those patients, and that was a pretty memorable moment for me.
Nice. I'm glad you got that moment. Yeah.
But what was hard? My hardest moment? I think the hardest moments are when you call patients to do like check ins or something, and either they don't answer, which is fine
Mm-hmm.
because then I can just move on and document it, but they
Yeah.
do answer and they don't want to talk to you. That's like the hardest. that's it's really challenging to like
Yeah.
to maintain empathy and then also like just get the questions across that you need answered.
Yeah. I know. What I feel like working in the hospital is that you don't really get mean or agitated patients, which is really nice. Like they're really appreciative of what you have to say and are wanting to be educated on their new medications. So that's really nice.
I think that's just the hospital that you're working at. I have empathy and I understand you come into the hospital like usually you're there for a serious issue, but I have had patients yell at me during my IP rotation.
Oh, really? Oh my god.
Yeah.
Yeah, I have to say though, it probably is because of the site that I'm at. It's really small, it's rural, underserved, and our patient population is mostly over the age of 65. We get a rare patients that's between the age of 20 to 24. Yeah.
So I guess I could like reflect on some lessons that I learned throughout
Okay.
my rotation.
I would
I
say
guess I
ask
learned
questions.
what ask questions. I
Yeah.
learned what business casual means.
But what does it mean?
Business, it's different outfit than what I thought it meant. So, business casual does not include denim
Yeah.
unless it's black. I think that that's like the cutoff.
I was just
But
thinking to myself that my business casual is so much more different than the millennials that I work with.
yeah, I'm just like I need better business casual. Okay, that will be our next episode. We will be talking about business casual outfits and what the real definition is and how business casual is interpreted through the generations.
Yes, I like that idea.
But what did you say was a lesson that you learned? Ask questions.
Yeah, that's the lesson that I learned. Ask questions. We're there to learn. We're students.
Yeah. And when you're going through your like midpoint reviews and evaluations and then your
Mm.
final evaluations, definitely have questions developed. And then all of the positives that they say about you, get a Word document, write those down, and then you can use those as qualities on your
Oh my
resume or
gosh,
CV.
that's a good tip. I need to
Yeah,
I need to go back to my evals now and see what
yeah.
they say about me.
I've been doing that because I just had my midpoint and she said some
Uh-huh.
things that I was like, wow, those are really good words that
Name
I
a
want
few.
on my, oh my gosh. Let me,
While you're looking
they're in
for
my
that,
book.
I would say my other lesson is don't afraid to be wrong
Hmm.
because that's how you learn and it helps you really solidify the lesson.
Yeah. I'm always afraid to be wrong. And I think even if like I'm probably right, I won't say
Hmm.
the answer because
Same
I
here. I
don't
will
want
say
to
it
be wrong.
softly.
Yeah, and I don't they don't want that. They want you to be
Yeah,
confident, and if you're not confident, I guess just say I'll look it up for you. I got too good at that. I got too good.
same here. While they're asking me the
But
question, I'm already searching it up.
but my qualities that she said about me was that I'm really good at analyzing and digesting information.
Oh my gosh, that's correct.
I'm good at taking information and applying it to other topics. There's probably
Nice.
a better word for
Strength.
that.
That's a strength.
Yep, strength. And I'm really good at managing tasks and I'm flexible.
Woohoo! Everyone, give praise to Michaela.
But
All right.
yeah,
Any advice for future pharmacy students that's going into a specialty pharmacy rotation?
to just go into it and work as hard as you can. I know
Mm-hmm.
that a lot of people will go into it like, oh, I don't know how to do this, but embrace that. Take the time to learn, like, take the information that you learn, apply it. Like, one of my strengths was apply it to literally every aspect of the
Mm-hmm.
job and just
Yeah,
really, really embrace it and try to do as best as you can.
yeah. I agree. I agree with everything that you say. My advice for going into hospital is take control of your learning. Kind of take that first week to digest really what goes on in a hospital, and then kind of pick areas that you want to see more. Like for me, it was to learn more about IVs and stuff and attending codes. And because I said that, I got to see a lot of that. So, advice is take control of.
That's good. That's good advice. But we
Mm-hmm.
are at time, and I just
Mm-hmm.
want to thank everybody for tuning in and listening.
Thank you,
And
guys.
if you can, in the comments on YouTube or on our Instagram, share your own clinical experiences. If you have any questions for us, shoot our Instagram a DM, ask us a question, and leave us some good reviews, give us some thumbs up, and we really
Yes,
appreciate it.
appreciate it. Don't forget to follow us. We are on most platforms: Spotify, YouTube, TikTok, and Instagram. Follow us at Let's Ace It Podcast.
Yes. And tune in next week where we will be talking about the definition of business casual. We'll see you then.
Oh my. Juicy. Bye.
Bye.